Methicillin-resistant Staphylococcus aureus, or MRSA, infection is a staph bacterium that is most notable for its growing antibiotic resistance. MRSA infections are commonly found in individuals who have gone to hospitals or other healthcare providing facilities. Antibiotic resistance often occurs when an antibiotic has lost its ability to contain or destroy harmful bacteria growth. When an antibiotic is administered, susceptible bacteria are destroyed, while resistant bacteria have a better chance of survival, a phenomenon called selective pressure. The most concerning method of bacterial resistance is caused by the abuse of antibiotics. The bacterial resistance of MRSA is significant. 94,360 MRSA infections occur in the United States per year, and 49 to 65% of healthcare-associated S. aureus infections are caused by methicillin-resistant strains.
Hey, how's it going?
Hi, Doc.
Hey, so how's recovery from surgery going?
Oh, it's going pretty well, Doc. My strength's coming back. Not feeling too weak anymore.
Good.
So everything seems to be going all right.
You sure? No other symptoms?
Well, there was just something on my arm that's appeared recently.
Want me to look at it?
Some red bumps.
Red
yeah.
bumps?
I want to take a look at it over here. It's a little rash.
That looks like a little bit like a staph infection. What exactly were the symptoms you were having?
So I've been having recently just a headache, a little bit of a fever.
A little bit of fever?
Yeah, but nothing else.
Normally for that stuff I just prescribe antibiotics, so it should
just
clear right up.
Okay, alright.
Honestly, I think I might have something like that could help.
Okay.
Temporarily.
Alright.
You know what I mean?
Okay.
Here, try these for a little bit.
Alright, okay, so
see what happens.
antibiotics, this should help.
Yeah, it should happen. If it doesn't, give me a call.
So it's not anything serious, I've heard staff.
No.
Alright,
no,
okay.
not at all.
Alright,
Okay?
well, thanks,
Well,
Doc.
As MRSA costs the U.S. healthcare system billions of dollars annually, it is important that hospital executives and policymakers and the government are made aware of the prevalence of MRSA. Along with the monetary damages due to MRSA, over 80,000 people contracted the disease in 2011 alone. Continuing to work to lower these numbers will save more patients and will save huge sums of money. There are already many effective policies in place to prevent MRSA spread in hospitals, which have recently led to consistent declines in MRSA infections. A new recommendation that has been proposed is that antibiotics should not be used to treat superficial cases of MRSA, as more antibiotic use promotes resistance. The CDC recommends simple procedures such as hand hygiene, gloving, and appropriate handling of laundry. These steps are in place to prevent the infection from spreading from patient to patient. Additionally, placing patients in individual rooms, whether possible, is recommended. These measures promote biosecurity by aiming to contain the spread of MRSA. Use of these simple strategies has shown promise, and continued use of these techniques will reduce costs of MRSA and the use of antibiotics.
Hello! How's my favorite
up,
patient doing?
I'm doing pretty well today. How about you, Doc?
Doing alright, just gonna scrub up a little.
Okay.
Still recovered from that surgery?
Yeah, recovery's going well. I'm gaining strength, feeling a lot better than I was a couple weeks ago. So thanks for the treatment.
That's
really
great, yeah. Feeling any other symptoms, or you're all good? What's up?
So I was feeling alright, but on my arm there's like some red bumps, a little bit of a rash appearing.
Oh, rash. Here, do you want me to take a look?
Yeah.
Any other symptoms you've been experiencing?
So along with the rash, around the same time it appeared, there's been like a headache and a bit of a fever. So,
yeah, well, taking just a quick look at it, looks like a minor staph infection.
Oh my. Okay.
Yeah, well, usually for this sort of thing, it's minor enough where we're just gonna, drain this abscess and see how it progresses from there.
So, I know for staph you could use antibiotics, right? So why won't that be a little quicker and more effective?
We usually reserve antibiotics for more extreme cases where, we're not sure the patient can fight it off on their own. So we give them a little boost of antibiotics. We don't like to overprescribe them because, it can increase the population's resistance, which will, lead to antibiotic bacteria, which we don't want.
Right, yeah, that would be bad. All right, so that sounds like good plan. So this will be drained. We'll have to stay a little bit longer then, just make sure nothing comes back.
Just
all right.
we'll get it knocked out later today.
Okay, all right. That sounds great. All right. All right. Thanks, Doc.
All right, just
Take care.
get rid of these gloves.
Oh, good. All right.